Every parent's joy knows no bounds when they hear their child's first heartbeat. It's a sign of life, of new beginnings, and an expectation of a future filled with love and adventure. However, for some families, this joy can be tinged with uncertainty when they learn that their precious child has been born with a congenital heart defect. In this video, we will explore different types of congenital heart defects, with a special mention of the Brompton Hospital in London, renowned for its groundbreaking work in pediatric cardiac care and world-class consultants like Dr. Mike Rigby. One of the intricate congenital heart defects is Tetralogy of Fallot, commonly referred to as TOF. This condition is a combination of 4 distinct heart defects that occur together, creating a unique set of challenges for the brave little heart warriors who bear them. Surgery can have excellent results for the child. A prime example is a patient named Lee. Born with TOF in 1970, he had surgery at 6 years old and is now 53 with 3 children. The first of these defects is known as a ventricular septal defect, or VSD for short. This is essentially a hole in the heart, or more specifically a hole in the wall, that separates the heart's 2 lower chambers, the ventricles. This defect can allow oxygen-rich and oxygen-poor blood to mix, which can lead to the second defect is pulmonary stenosis. This involves a narrowing of the passage leading from the heart to the lungs. As you might imagine, this makes it harder for the heart to pump blood to the lungs, where it can pick up the oxygen the body needs. The third defect, overriding, is when the aorta, the main artery that carries oxygen-rich blood from the heart to the rest of the body, is positioned directly above the ventricular septal defect, instead of its typical position over the left ventricle. This means that oxygen-poor blood can flow directly into the aorta instead of going to the lungs. The fourth and final defect is right ventricular hypertrophy. This is a thickening of the muscular wall of the right ventricle, which can cause the heart to work harder than it should, and may lead to heart failure over time. Lee underwent surgery for his TOF at the age of 6, as is now common with advances in medical technology. Children may experience episodes known as TET spells, where their oxygen levels drop, causing their skin to take on a bluish hue, a condition referred to as cyanosis. These spells can be frightening, but with immediate medical attention, they are manageable. TOF is a complex condition, but care children can lead active lives, just like Lee. He is now 53 years old, has 3 children, and lives a fulfilling life. Most children with TOF can now undergo corrective surgery in infancy, significantly improving their prognosis and quality of life, as demonstrated by Lee's example. Another common congenital heart defect is the ventricular septal defect, or simply VSD. This defect involves an opening or a hole in the septum, the wall that separates the heart's 2 lower chambers, known as the ventricles. Imagine your heart as a house, with 4 rooms or chambers. The lower 2 rooms, the ventricles, are for pumping blood. Now think of the septum like a wall in the middle of this house, keeping the rooms separate. In a healthy heart, the right ventricle pumps oxygen-poor blood to the lungs, while the left ventricle pumps oxygen-rich blood to the rest of the body. The septum ensures that these 2 types of blood don't mix. But in a heart with a ventricular septal defect, there's a hole in this wall. This hole allows oxygen-rich blood from the left ventricle to mix with oxygen-poor blood in the right ventricle. As a result, too much blood can end up being pumped to the lungs, causing the heart to work harder than it should. The effects of this hole can vary greatly depending on its size. A small hole might cause no noticeable symptoms and may even close on its own as the child grows. But a larger hole can lead to more serious complications. These can include breathlessness, failure to thrive, frequent respiratory infections, and in severe cases, heart failure. In some cases, a ventricular septal defect can be detected before birth during a routine prenatal ultrasound. In others, it may not be discovered until after birth, when a doctor hears a heart murmur during a checkup. Treatment for a VSD depends on the size of the defect and the child's symptoms. Small defects that cause no symptoms may simply be monitored, but larger defects often require surgical intervention to close the hole and prevent further complications. Despite the challenges VSD presents, timely surgical intervention can significantly improve the child's health and quality of life. The Brompton Hospital in London is a beacon of hope for families dealing with congenital heart defects. With its global reputation for excellence, the Brompton Hospital shines brightly in the field of paediatric cardiac care. It's not just a hospital, it's a sanctuary where life-saving surgeries are performed, where the impossible becomes possible, and where little hearts are mended. Families from every corner of the globe trust the Brompton Hospital. They embark on journeys, crossing oceans and continents to place their most precious ones in the hands of the hospital's world-class medical team. Each heartbeat that leaves the Brompton Hospital stronger and healthier resonates with the hope this institution brings. The Brompton Hospital's unwavering dedication to advancing paediatric cardiac care is not just about healing heart defects. It's about giving every child a chance to experience life to the fullest, to dream, to play, to grow, and to become the little warriors they are destined to be. Institutions like the Brompton Hospital are vital in providing life-saving treatments to children with congenital heart defects. At the heart of the Brompton Hospital's success is Dr. Mike Rigby, a world-class consultant in paediatric cardiology. Over the span of his illustrious career, Dr. Rigby has dedicated himself to the cause of treating congenital heart defects in children, making a significant impact on countless lives. He's not just a physician, but a beacon of hope for families navigating the challenging waters of congenital heart defects. His decades of experience, coupled with his relentless pursuit of knowledge and innovation, have made him a pioneer in the field. Dr. Rigby's commitment goes beyond just treatment. He invests time in understanding each child's unique case, ensuring they receive personalized care tailored to their needs. His work is not just about mending hearts. It's about nurturing the spirit of resilience, strength, and courage in these young warriors. Experts like Dr. Rigby are turning children with congenital heart defects into little warriors, ensuring they receive the personalized care they need.